Hi, I'm Christy Deem. I am going to talk about first the kind of my three aha moments during the course, some topics that really interested me. So I really liked going over some of the theories and frameworks, and one of them that really caught my eye was the most recent one that we covered in week 8, the videos by Ebright and her complex adaptive systems theory. So she really had some good examples of just kind of explaining how complex nursing is. It's not just a bunch of tasks. It is having the responsibility of taking care of patients, going into the patient's room, and maybe from the patient's viewpoint, you're not doing anything, but really when you're going in to see a patient and do your assessment, you're looking at the patient, you're assessing their patient, you're looking at their skin color, you're looking at how alert they are. There's just a whole myriad of things that you're looking at. And in her example, where the nurse was getting the patient up to ambulate, the patient said, "I don't feel well." And instead of the nurse pushing, because the patient was post-operative, and sometimes, Ebright had said, and in my experience too, you got to push patients a little bit to get them out of bed because they're sore from surgery. But what the nurse did in that instance, and what many of us do, is we're like, something's not right there. I see that she's a little bit pale. All we did was sit her up. Okay, so let's lay you back down and let's come back in a couple of hours and see where you're at. So that's really an example of what nursing is, and it is an example of her Ebright's framework of complex adaptive systems theory, which is that there's a series of events that occur. The nurse has to assess, evaluate, reevaluate, and come up with a plan. What's the intervention going to be? What's the strategy going to be here? And so she just does a really good job of putting a framework around what nurses do minute to minute, day by day. So that one caught my eye. Another model that really caught my eye was the synergy model, which was developed by the American Association of Critical Care Nurses. And their theory, what they did was they had sort of like certain characteristics that they were looking at, 8 characteristics that nurses evaluate. A few of them were resilience, stability, complexity, and so these are all things that nurses evaluate in order to make decisions. So an example, what I wrote in my discussion was stability. Like in critical care, stability is huge. You are constantly assessing stability because these patients are so critically ill. And that was one of the reasons why I really related to this synergy model, was because of that, because it really hones in on what a critical care nurse is doing. Post-anesthesia care unit, I also worked in, and that also makes sense in that realm. And the biggest thing post-operatively that you're looking at is, again, stability. You're looking to make sure that the patient has a patent or open airway to breathe. And that's an important thing post-operatively because they're coming out of anesthesia. You're going to be giving narcotics acutely to give in the recovery room. And so a lot of, the narcotics can depress respiratory rates. So you're constantly assessing to make sure that the patient is breathing, that they have an open airway, that they can breathe on their own, that you don't need to put an oral airway in. And so those kinds of things, those are all things that you assess. And again, this synergy model developed by the American Association of Critical Care Nurses, this model really sums up and provides a great framework for nurses, critical care nurses, and just floor nurses too, because of the characteristics that you're looking at that nurses constantly evaluate in their patients. And the third thing, which is not a theory for me, which was interesting, I didn't grow up with computers in my hand. I didn't grow up with computers at the bedside. So I've always been really confused on what exactly is informatics, what is informatics in healthcare, what the differences are between, a healthcare chart, all the abbreviations. I'm just not familiar with any of that, and I don't have experience with any of it. And so that week that we covered informatics really helped me understand what it is and how you can, how it has really helped with healthcare to increase safety outcomes for our patient. It helps overall, it helps with improving patient outcomes. Interesting article that I read in regards to relating it to what I'm going to be doing, which is education of nursing students. There was a study that I came across with this assignment that even the students who have grown up with technology were having a hard time after graduation figuring out informatics and healthcare technology after graduating. And what the study found was that students felt like they didn't have enough education around informatics in healthcare, around the electronic health record. And so I think that'll be an important piece as I start working to kind of make sure that students are getting that piece, because they go into the workforce, according to this study, not really feeling competent in their skills. So next, I think I'll go over the 3 assignments for best learning for me. So week 4, we went over what was an interdisciplinary team, and we did a group project on PowerPoint for ours was on team steps, and the group appointed me as the team leader. And so actually through that exercise, so the objective was to recognize the development of team, so like group dynamics, communication, and conflict management. I actually learned that working hands-on for the project. And I learned that communication is essential and not to make assumptions. I had a team member that really wasn't contributing to the content of the slides, and it was getting to the last day and she hadn't done anything. She had helped a lot with the slides and images and formatting, but then when it came to content, she hadn't done anything. And by 5, I sent out an email, probably a little bit earlier, to the group, and I said, hey, I'm gonna do final edits when I get back around 7, so please wrap up everything that you're doing, and I'll do the final around 7. She didn't respond to anything. She said okay, and then I got home and nothing was on her slides, and 8:30 rolls around right as I was getting ready for bed, and she is having difficulty with getting her content onto Teams. And I was exhausted. We had some family things going on, and so I didn't communicate with her until the next morning. And I wished I would have been more direct with her earlier before I left for that meeting. And so that would have been maybe prevented some just assumptions going on in my mind that the work wasn't going to get done. So that was the big piece there, is that I should have, reached out to her, maybe called her even if something wasn't done. And that way I could have prevented this, or maybe had more of a deadline of please get all of your stuff done by X. Beyond that, I can't, guarantee that I can get to, and that type of thing. So I really learned about being very clear on your communication. The second assignment that I found really interesting and helpful was the PICO assignment, where we were to, come up with a clinical problem and come up with the PICO question. And so mine was just on asthmatics. And I really found this tool interesting because I think you can apply it in several different areas, not just in research, not just in developing a research. It really narrows, that PICO really narrows the problem down. And so it really helps with honing in and then actually coming up with a process. So the C, you're going to compare and contrast. And so that's where you would do your research and potentially your evidence-based, base it on your evidence-based practice from the research that you do. So I thought it was a very good practice or good assignment that I learned a lot from. And the third assignment was actually this assignment, this video, to come up with this video. I thought in the beginning that, oh boy, this is going to be challenging. But it really makes you think about, what it is, what did we cover this 8 weeks? What did I find interesting? And it kind of helped me kind of reflect and kind of put things together and help me remember too of all the different concepts, because this is pretty quick. 8 weeks is so fast. So this really helped me kind of process the information that we went over and that we learned, and you kind of get a good sense of, hey, we did cover a lot, and there was a lot of material there, and so I like this assignment because it really helped you process the 8 weeks that we just finished this assignment. So the final thing is other experiences. So the other experiences when you first start your program. I started a year and a half ago. Well, yeah, a year. Yeah, it was a year ago. And I'm finishing up in the end of February. So as I look back, I took advanced assessment class and the pharmacology and / pathophysiology class, which I think was a very challenging combination of coursework. They're very intense as far as like the amount of information and the concepts that you're putting together for those two classes. So it was super intense and a little bit stressful, but I felt like I really overcame that and really, completed the 2 courses and actually moved forward from there. The biggest thing from those courses was I really found out that, hey, writing isn't that bad. I learned about the APA formatting. I learned that I could write and that, I wasn't that bad of a writer. I mean, after all these years of being out of school, I was able to put pieces together and to come up with some good, decent writing assignments. So overall, I feel like this whole year has gone by so fast. And that I only have a few months left. It's unreal to me of how quickly this has gone. And I'm super proud of myself for jumping in and jumping into actually, pursuing my dream of being an educator. And yeah, so I'm just pretty thrilled with the program and all that I've accomplished so far. Thank you.